Hello and welcome. So right now we're going to do the hip treatment for a Tui Na class. So we're going to begin with rolling. So taking your time to roll the glutes, the hamstrings, and just the whole general area. If you're going to do both hips, I would just go from side to side. I'm going to just stay on one hip for now, but if you're going to do two hips, again, it seems like you might, when we're rolling and we're rolling for a good long time, you might always want to just pause the video and give yourself the opportunity to do a thorough job. So I'm going to roll just a little bit to get things softened up. Again, you can go over to the other side whenever you're ready. I'm just going to stay on this side. All right, so let's say you've rolled for a good 10 minutes. Okay, now we're going to do this cool technique that is called pinning. And someone, you know, when you are a massage therapist, you get massage from all kinds of people, and someone does a move and you're like, I'm taking that one. So I took this one from, I don't remember who, but it's pretty cool. So basically what I'm going to do is I'm working from the edge of the sacrum to the greater trochanter. And so the greater, if I hold the foot here, if I go in medial with the foot, see how his hip comes up? So that's rotating and shortening the gluteus medius and maximus. And then when I come out and I rotate this way, it's lengthening it. So you're moving the muscle. So as you're doing a compression, so first I'll come in. You can use whatever part. You can start with something like your fist. Let's start with a fist. And I'm just going to come in. I'm going to go along the edge of the sacrum, and then I'll move this foot nice and slow. And you're going to come across this often. People will want to help you, so then just go back, go slower, try and get them not to help you. And if there's nothing tight, you're not really going to feel much. But if you have, so what I noticed when I did this is that he's a little bit tighter, up a little bit higher. So I'm going to go a little bit higher. Now I'm going to use my knuckles here. Again, you can use fingers, you can use forearms, whatever tool you want. And do a nice compression, and then medial and lateral. So I'm going to continue. And this is basically it. You're going to thoroughly go through the entire area. And when I find something to work on, I'll stay there for a while. But I haven't found anything yet. There was a little bit, maybe I should come back up here. I can get specific with a thumb. Okay. I'm going to come out even more lateral. Gluteus medius, a little bit of tensor fasciae latae with my thumb or a fist or fingers. So this is a thing where you want to be really thorough. Could take a lot of time doing this, so if you want to go ahead and stop the video so that you can practice this for a while and explore, just go all around the glutes. And just one reminder is that flexing and extending does nothing for the hip. It's a movement in the knee. You want to have the leg at 90 degrees, and then we'll move the femur. See how his hip moves there? His hip moves here. And you also want to be careful in this direction. If someone has knee issues, you might have a limited range of motion here. Knee issues and hip issues a lot of times go together. So be mindful of those things. All right, we're going to get our partner, our client, side lying. Okay, so now I've got my client side lying. I use the face cradle cushion for their head here, and then I've got a pillow underneath. I've got his femur that's flexed 90 degrees to the torso, and I could maybe have a little bit more pillow. Ultimately, you want the knee at the same level as the hip, but that's good enough there. And we're just going to begin with rolling. And so We've got a lot of area to cover. We're pretty much going to come from the hip and go all the way down to the ankle. So just, you'll move back and forth. So you'll hang out on one side for a while. And of course, really getting that iliotibial tract, gallbladder channel. And again, coming around. And now I can get the glutes here much better. So be mindful of your body mechanics. Make sure that you don't bend over. If you find yourself reaching at all, then move around to the other side so that you can keep your back nice and straight. I really want to get on the sacrum. And just all around, especially the greater trochanter. And I'll remind you again, I like to roll for a while, so you can always pause the video and get some more rolling and done. All right, now we're going to go through the points. I like to press rub the points. So, but again, if there's another technique, if they're extremely sensitive, you could finger spring or on. So I'm going to get gallbladder 29. This is the new one. And gallbladder 31, I'll remind you, I'm sure you heard before, it's a strike point. So that means it's used in martial arts to really collapse your client. So be mindful of that. It tends to be very, very tender, or what we might call ashi. So here's 31. Oh, but we got to go back to 30. This is gallbladder 30. Everyone loves gallbladder 30. Right in the center of piriformis. So 29, 30, 31, which is a strike point. And then I'm going to walk around to the other side and get, it's my habit to find 34 first, which is directly below the head of the fibula, and then it's 33 is 3 soon above that. So we're right on the condyle of the femur for 33. And then measuring for 39. And then 40. So like I do in most of my treatments, I'll do the points and then I'll do them again and then I'll do them again. So I'll go through them one more time. Gallbladder 29, gallbladder 30, gallbladder 31, coming around, gallbladder 34, and gallbladder 33, and then gallbladder 39, and 40. All right. So you can throw in rolling whenever you want. I'm going to come over to the other side. This next move feels really good, and it should be pretty vigorous. But the thing that you need to be mindful of is I usually come in and hold, I cup my finger around the as-is here, but some people are really ticklish in their as-is. So I've made the mistake a couple of times where I'm doing my massage, I'm not thinking, I go in and I grab that as-is and the person jumps, because it's ticklish. So kind of come in and I'm holding him. The reason why I'm holding him is because I'm really going to use a lot of force, and it's a medium need, so there should be a lot of movement. Keep him from falling off the table. And then I might switch hands and just kind of get the whole area. There you go. That's the medium need. Feels really good. Okay. Okay, the SI joint. So the SI joint, the sacroiliac joint, is where the sacrum and the ilium articulate. So finding, can I go to the skeleton?
Yeah.
Okay, so we're gonna work on the SI joint, the sacral iliac joint. So to find the location that we're looking for, come to the center of the sacrum. So you'll see these spinous processes, and just move a little bit lateral, and you're looking for this lip right here. It's pretty distinct. I'm actually gonna switch over to this side. I want my thumb to be medial to the posterior superior iliac spine. My hand's gonna come around and hold the as is, and then I'm gonna pull the hip back and push the sacrum forward. So that's just gonna get a little bit of rocking right at this SI joint. This can feel really good on a lot of people, but some people it's just too tender. So I just wanted to give you a visual for where we're actually doing it. Now I'm gonna go back to my plan. I go to the sacrum, I'm right in the center, and remember a man's pelvis is narrower but taller. So his is up here. I come in and feel for that lip. There it is, I've got it. I'm gonna put my thumb, so my thumb is basically on the sacrum, my other hand's on the ilium, and I pull back and push forward. So it's just like this. And there you go. All right. Okay. Ooh, a TN. A TN is like a deep tissue move. It's the heaviest, it's the most penetrating of the techniques what you're accessing acupressure point. So it takes quite a bit of time, and you're going to sink in. So you want to obviously get in a nice stance. It's gallbladder 30 is the one that we're talking about. I could use my fingers if I wanted to. I could use my thumbs if I wanted to. What I usually see people though is coming in and using the elbow. So just like any other compression, you want to sink in a little bit, and soon you want to stop before you feel resistance, and then hang out and then sink in a little bit more. And I'm using my stance to really give me the leverage to do a compression. If you're trying to get stronger and you can't go further, if you just make the surface area smaller, that's going to increase the pressure. And then you want to come out just as slowly as you went back in. So going back, creating more surface area, and slowly coming out. So TN does take a bit of time. And probably a little bit of roll. Okay. Now we're gonna tway down the iliotibial tract. I climb on the table all the time. I work for myself, I'm self-employed. Probably if you're employed by someone, you're not allowed to climb up on the table. So I'm going to show you the way I do it on the table because I feel like it's more efficient, and there probably are some of you that are self-employed and it's okay for you to get on the table. And then I'll show you another way for those of you who can't get on the table, or maybe you don't feel comfortable getting on the table, then you certainly shouldn't get on the table. So I come in and my knee is here and my foot is here. I've got a lot of leverage because I've got my whole body weight, okay? And I'm going down the iliotibial tract, which is usually extremely sensitive. So you need to go in layers. And you got to remember, you got a lot of power in this position. So I'm going to come in and I'm going to use my forearm and just nice and again, if the clothes don't let you glide, then if you just kind of rotate your hand, see how I kind of slip when I do that? So I'm doing a stroke down the iliotibial tract. You definitely want to stop before you get to the knee. So it can be a pretty intense experience for some people. So coming up, I don't get on top of the greater trochanter because that doesn't feel good. So I'm just below the greater trochanter, and I'm going to work in layers. Each time I go, I'll be a little bit stronger to my client's comfort level. So some people are super sensitive. So that's how I do it on the table. So you're going to need to make up your mind about how you feel about this. We're going in this direction because this is Tui Na, and the meridian goes this way. So I hold my arm like this and pull my arm to me. It's not the greatest thing for your shoulder. That's why I like the other way better. But in sports, they go up, and that's better body mechanics. So I'm going to stick with the spirit of Tui Na and come down, but if you want to go up, do whatever. So I hold on like this. I'm in a really wide horse, bow stance. And then coming down. And there, same thing. Don't have the same kind of power I do on the table though. But you a lot of times don't even need it. So that's two-way of the iliotibial tract. Okay, so now we're going to roll and make nice. Put it back on the table. And come to the other side. Roll. So give them some nice rolling. And then we're going to, if you're going to do both hips, then we would stop and go back, turn them over, get the other hip. I'm going to go ahead and go forward and go to the anterior of the leg up. So you do what you need to do. So we've got our client laying face up on the table, and we're going to roll. So be in a nice bow stance. Really get the thigh coming up here. Getting along. Now we can really get the iliotibial tract nicely. Easier to get it than when they're face down. Of course, we get it really well when they're on their side. And now I'm going to come in and Na. So really honing in on that gallbladder channel along this side of the leg. And just all the quads. Again, you got a good Na, you should see a lot of movement. All right. So now we're going to do some passive joint movements. And so I'm going to pick the knee up. So first we're going to do flexion and extension. So I'm going to, when I do flexion and extension, I like to have my hand on the lateral side of the knee, and I hold on to the foot. And I like my hand on the foot because I get in my bow stance, and then I just shift my weight and push the foot. So I'm feeling for his range of motion. He's got a pretty tight hip. Some people, their leg comes all the way down to their chest. We're in a good place here. So I'm pretty much here. Now I'll do a series where I'll come out of flexion a little bit, and then come out a little bit more lateral, and then again, press. And then come out. And then when I get to here, I like to put the leg on above my ilium, and then come in and press. I might be mindful of the other leg. And then come out, and then one more. So those are the flexion extensions. Then we're going to do rotations. So there's a lot of different variation on this. Sometimes I'll do the rotation with my hand on the lateral side here. I usually start with smaller ones, but then I like to get bigger and bigger. So then I change it by coming in, getting my hand underneath the knee, and so I get in my bow stance and I push away, and then I pull back. Push away, pull back. Nice big rotation. Okay. Now we're going to abduct the leg. So this is, you got to be mindful. I let the foot rotate any way it wants to. I don't force it forward. I don't force it out. I step forward in my bow stance, and there's a little shelf on my hip here. Oh, you know what? I want to switch legs. There we go. And the reason why this stance is so great is because I can just shift my weight forward, and I'm going to come forward a little bit more. So I'm feeling for his resistance. I'm feeling for tightness here. I want to go really, really slow. So I'm supporting under here. My leg is supporting under here. Occasionally you might have someone who you might need to support their knee. I don't feel like I need to do that in this case. And since I was talking, he released a little bit. I was able to go a little bit more. So this is usually 90 degrees. It's fairly average. He's a little bit below that. I've worked on people where I've got their foot next to their ear. So that's not very normal. I think in 23 years of doing this, I've done that twice. But it's fun when it happens. So now I've been hanging out. So this, the first part is a nice stretch, but now I'm also measuring. So this is pretty much his limit right here. So I'm going to do a circular movement. So I want to back off a little bit. And now when I do the movement, I've measured for his limitation, so I'll never go beyond that. So I'll use my body and rowing. Remember, he's resting on my thigh here. And he's protected because I've already measured. I'm not going to go past his limit. All right. And then we're going to bring the hip down. So this next move is really nice opening for the hip. We did something similar in the knee treatment. It's just similar. So I'm going to hold it. My hand is above the calcaneus right here in the Achilles tendon. My other hand is on top of the ankle. I'm in a bow stance. I'm going to shift my body back, and then I just vibrate the leg. And slowly go back. And if you're going to do the other hip, then go back, start this part over again. But that's the hip treatment for Tui Na. Thank you very much.